We can just again highlight the statistics around the issue of teenage pregnancies that clearly you have now dismissed, that there is no link between the high levels of teenage pregnancies and social grants.
There isn't, there has never been, but it's a make-believe story. Well, it predates the term fake news. It falls in that category of fake news. Obviously, people react to things that they think are problems. And society certainly is correctly worried about how life is brought. Bringing life is a responsibility. And it requires to be brought when people are ready and can react responsibly to bringing such life. So in that respect, therefore, it is a matter of concern. And therefore, everything has to be done to ensure that when that happens, it is a desire of those who want it to happen. The problem is that in South Africa, and as well as in somewhat parts of the world, but in South Africa particularly, men fail to take responsibility over their children. And it's a big problem. And part of the social ills that we have are in part not taking care of your own children. So it's a serious problem. So when the grannies associated with social grants, I think they are only expressing their frustration, but they are hanging their linen on the wrong fence. It's the wrong fence altogether. There is no evidence that teenage pregnancy is associated with grants. This data has just dismissed it.
Your overall sentiments about the report that you have released, obviously highlighting and again putting the status of South Africa's health under scrutiny. What would you say if you had to summarize it? What does the report tell us about the status of South Africa's health?
The report points out to improvements in health. And of course, it would have been expected given the interventions that the Ministry of Health have put in place. If it didn't happen, then it would have been money down the drain. The problem, though, is that the socio-economic determinants of health outcomes is where the problem lies. I mean, stunting is not a health, it's a health outcome, but it is something that has to deal with whether people are eating or not eating. So that's one which is very, very problematic, and no matter how much you put in a health facility, it will never resolve the problem of stunting if people are not eating well. So that part shows it's very, very stubborn. Things like immunization, the coverage is it's clearly there. Coverage it's progressive, and we can see that the mortality, both child and infant, have actually dropped over a period of time, and life expectancy has increased. Obviously, we have not released all the data, including one on prevalence and incidence of HIV and AIDS. That's an installment for another time. But the indicators that we have released today do show that health outcomes are getting better. But it is the socio-economic arena that is quite problematic. Of course, including smoking, that has dropped. But it still remains high, and alcohol, and then of course abuse, spousal abuse. All those things impact on health. So health per se, probably they are doing what they can, but that environment has to be corrected.
All right, thank
you. Yeah.